President.
The Senator from Utah.
Mr. President, I ask unanimous consent that during the next hour, those senators who come to the floor may be allowed to proceed in a colloquy.
Without objection.
Mr. President, I have come to the floor early before the Republican hour started so that I could listen to what my Democratic friends have to say, and I found it quite enlightening, and I have a few comments I'd like to make with respect to it. They've been debating very vigorously against the status quo. They've been giving us examples, heart-tugging, real-life examples of people who are finding difficult problems in the situation as it now exists, as if the debate were between the status quo and doing something. The debate is between the solution that has been offered by the majority leader and other solutions which people on this side of the aisle have been trying to bring forward through the entire time and have not been allowed to come forward. We recognize that things need to be done to fix problems with respect to the health care situation. We realize that the legislation that we've been living with for all these years needs to be amended, and we've been unable to get any of our ideas come forward. And now we're told there is such urgency to deal with the status quo that we must pass this bill, and we must pass it virtually without amendment. I would like to point out, as I have done before, if there is such urgency with respect to the challenges we have in health care, why do we wait until 2014 to have those changes come? We've heard all of these examples coming on the Democratic side of the aisle of people who have terrible problems under the health care plan. We must act. We must act immediately, and the act will be to say to all of these people, we'll solve your problem in 2014. We will delay all of these reforms that we're talking about until 2014. Now, I made that point the other day, and the senator from Maryland said, no, some parts of this bill will begin immediately, and he's exactly right. The parts of the bill that would begin immediately are the taxes. We'll start taking in money in 2011, indeed in 2010 if this bill passes. The annual pharmaceutical manufacturer's fee would drive up the price of everybody's drugs, an annual non-deductible $2.3 billion fee. That will begin in 2010. The medical device manufacturer's fee of another $2 billion, that will begin in 2010. The medical insurance provider fee, that will begin in 2010. The cosmetic surgery fee, that will begin in 2010. In 2011, there will be a limit on contributions. In 2013, a high-cost insurance excise tax. All the taxes are front-loaded. But all of the reforms that they promise this bill will bring to all of the people whose stories they told us will not take place until 2014. The status for them will remain quo. For all of these attacks on the status quo, the one change we'll get is that they'll start charging the taxes, but they won't start delivering any kind of health care reform until 2014. And why are they delaying until 2014? Not because they don't think people need it, but because they realize that if they start spending at the same time they start taxing, the score they will get out of the Congressional Budget Office will point out the true cost of this bill. And it is the true cost of this bill that is the kind of thing we need to be debating and talking about rather than listing story after story, and my state is full of them, and I am just as sympathetic as anybody of people who have problems with the present health care system. That's a false debate. We all realize, all 100 of us realize that something has to be done to make the health care system better. This is not should we do nothing. This is a debate about what should be done, and the proposal we have from the majority leader is not the answer to the problems that we face.